Welcome to the Field Notes podcast, presented by Seaworthy Functional Medicine. Seaworthy exists to help you overcome your complex health challenges so you can be fully vital. Now, here's your host, Dr. Rob Downey.
What are extra dimensions that women can know about, or people that care about women in their lives can know about, to greatly decrease their suffering and improve their health? Today, we are so fortunate to be joined by Dr. Jeff Brown. Dr. Jeff, thanks for your time today.
Oh, thank you for having me. Thank you. Appreciate it.
As we were getting ready for today, we talked about the fact that you and I do have a similar origin story. We're both board certified family medicine physicians. And at some point in our journeys, both of us said, there's got to be more. Do you want to share a little bit about that? What motivated you to? The origin story is often super interesting.
Yeah, I remember, I trained in New York, moved out to Las Vegas. I was tired of the cold, tired of, you know, paying all those taxes in New York. And my first job was working at an urgent care, primary care setting. And I remember, after a period of time, it was just a lot of refilling prescriptions. It was just, okay, and these people could have, 8, 10, 15, prescriptions that they've been given by different specialists and doctors, over the years, and then people would come in and we would just, refer out to different specialists. And it just kind of hit me, just driving home and, coming back after a while, I'm like, I don't feel like I'm making a difference, here at all. I mean, I just feel like it's like a band-aid. It's just like the same kind of hamster wheel, that we're doing. But I'm not really seeing people's lives, improve significantly. I wasn't seeing people that were just, there was no change. They weren't excited about, they just were existing the way I saw it. And I'm thinking, that's like, this isn't what I thought medicine was going to be. When I got out of medical school, I said, this got to be a better way of doing this. And that's what led to the journey of figuring out what I need to do or what's out there that I know is out there, to facilitate, better healing, better management of patients, not just keeping them on that same, treadmill, every month or 2 months, whatever that cycle was, refilling your scripts, refilling your meds, and see you again in another, 3 months. Like, we could do better.
Yeah.
And so that's what led me down that journey.
Right on. And you got training in functional, and am I remembering this right? Also, functional and regenerative medicine. So you pursued that extra, got a bigger toolbox.
Yes. Yes. Yeah. A4M.
Hmm.
As an osteopathic physician, we are trained with the hands-on approach,
Hmm.
believing that the body can heal itself. We just need that extra help sometimes. And I really had a passion helping with people with pain. So as an osteopath, being able to use my hands, to me, that was really important. That's why I only applied to osteopathic schools. But then, there's certain conditions there I needed more than just my hands. And that's where regenerative medicine, came in, very nicely, learning more about the tools that we have with, again, taking things from our body, right? With the platelet-rich plasma, stem cells. There's a lot of things that, that God gave us in our bodies that we can use to heal ourselves. So that's why that was important, piece that we can use to, help people get rid of pain.
I think DOs have an advantage over MDs that more of the training is about the body knows the way, so that kind of starting with the door a little more open, perhaps.
Yeah, the philosophy, the core
Mhm.
philosophy, again, like you said, the body can heal itself, and that's our core principle. And we just have to figure out how to do that. And being able to use the hands, I think is an advantage because everywhere we go, our hands are with us. So if someone has headaches or breathing issues or whatever, sometimes I can just put my hands on people and do some things to help them get some relief. So I
Mm.
agree with you.
Well, so both you and I just have this as such a big part of our practice. Then I guess kind of a two-part thing. Correct me if you have a different experience, but women talk about painful periods, irregular cycles, uh, endometriosis, etc. So sort of the hardware, the software, the plumbing, all uh, not in harmony with the woman's life and her desires. That's one
Yeah.
part. And then the other part is that they're often not heard, which either triggers feeling disenfranchised or enraged or both. So both you and I in our practices presumably say, I hear you,
Yeah.
and here's what I can offer you. So one thing to start with is just, I think this one's super important because this one doesn't get talked about enough. Um, so women are often told that painful periods are normal, but they're not. Is that a good place to start? Just all these things that women are told that are, let's drop in
Yes.
there.
That's a great start. So, I mean, what is pain? Right? If you think about, okay, what is pain? What was the design of pain? And that obviously to me, it's a warning signal. It's telling the body that, there's something going on here. You are either going to damage tissue right now or very soon, we're going to have a problem, right? You touch a stove, you twist an ankle, we know, okay, there's a problem there. There's some damage taking place. But for whatever reason, with women in their periods, we kind of, dismiss it, as if it's just, no big deal. Yeah, because so many women suffer from it and because it's common, we always think is normal because something is common, but that doesn't make it normal. And I think a lot of times it's because things that we don't really know how to approach. I'm thinking about in the conventional world, if there's really not great treatments, they kind of dismiss it because they say, well, what can we do about it? Anyway, so just suck it up and push through. I also think that because we know that women when they're in childbirth, giving birth, it's a painful experience. And so I think people kind of extrapolate from that. Well, you're used to the pain anyway. You gave birth, you're supposed to have pain. That whole experience down there, I think, kind of gets lumped together because, they are going to give childbirth. And because you have that experience, the menstrual cycle every month, it's just part of it's just part of being a woman, right? It's just part of the suffering. It's just part of, what you're supposed to, to have. And I would say that, that is incorrect, that a normal cycle should be just that, just, you bleed once a month, the uterus grows, expected pregnancy is not there, and then you bleed, and then we move on to the next month. It should be uneventful. It shouldn't be associated with the mood swings, the cravings, the painful periods, the headaches, a lot of things when people are imbalanced that's associated with it. And that's not supposed to be normal. That's to me, that's a sign of nope, body's telling you there's something going on and we need to address it.
Excellent. Excellent. Well, I'm sure a lot of our audience who I think for joining us will resonate with. And I think then a logical segue would be let's kind of use that as an example. So uh, how what would be next steps in your approach for a woman with that picture again? Because we've got a lot to talk about today, but in some ways exploding it out around one case sort of gives people a chance to get their arms around it.
Yeah, so there's a couple of different ways that you can approach it. I look at it two different ways because of different types of testing, right? You can do saliva testing. There's some physicians who prefer the saliva method, so you can see what the free hormones are. And then you can also do blood work, so depending on who you speak to, you're going to have different philosophies out there. Typically I use blood work because that's covered by insurances for most of the time. And you should be doing this during the luteal phase, right? I would say, okay, look at your periods between the blood work between days 19 to 21 of your cycle. And people ask me, okay, well, why are we doing it during that time? Because it's all about the relationship between progesterone and estrogen, right? That's the peak where progesterone is coming into play. And usually I find that that's the issue anyway, is it's a lack of progesterone, or it's that imbalance between estrogen and progesterone, which is causing these symptoms. So you want to see, what that looks like during that time. And so then once you get the blood work back, then we can take a look at that ratio and then figure out a plan of action based on what we see. Right. Now we're also looking at testosterone as well. And testosterone definitely plays a role in that as well. And so all of your sex hormones need to be, in balance and have optimized ratio. And there's different ways that we can approach, each of those hormones, whether it's natural or, going on the hormones or just doing things on your own to see if we can ramp up that production or to create balance. But testing is key. And that testing has to be done during that luteal phase. And if it's not during that time, of course, progesterone is going to be low, if you're just doing it anytime. So if you're going to get your labs tested, make sure you're doing it during the luteal phase, not, at any time during the month, because you're going to get inaccurate information.
Right on. And if a woman's interested, how much can they expect sort of lifestyle things, you know, like I don't know, you know, just attention to health, healthy whole food, rest, etc. I mean, maybe seed cycling, different takes on that. How much can they expect supplements to play a role? To what degree do you think a lot of women end up with some degree of, you know, bio HRT? I mean, are there some ratios women can kind of take away from this about how much or how little, or is each plan a tailored jacket made for just that woman?
Yeah, no, each plan is tailored towards the individual because, as you know, uh, each woman is different, right? There's some who are stay-at-home moms, so they are staying at home moms, so they have maybe some more flexibility when it comes to timing of doing things. And then you got mothers who are so busy at, have to work, they have kids. So a lot of it is based on, their time, available time to do things, and also finances, will play a role, with them as well. But for me, I believe that food, nutrition, exercise is so key. So
Mhm.
food, we all know, some of the things that are out there now you can't even define as food, but they go in your mouth, so people are going to call it at food. But really looking at, hormone-free foods, so the dairy, the meats, really avoid the hormones, that's really disrupting, our hormone cycles from kids, from birth to, to adulthood, so that plays a role. Pesticides, interfere with hormone signaling. So I encourage women to buy organic or things that don't have the pesticides in it, as best as you can, because that's
Mhm.
interfering with signaling. So the fruits, the vegetables, about the dirty dozen, as far as the environmental worker group. So I would say if you're eating the whole fruit or the whole vegetable skin and everything, those really should be, organic. If you're not, banana, watermelon, or things that you're peeling or eating the inside, then don't worry about it. But really we got to avoid, the pesticides. Exercise. Everybody knows that exercise is good for you, and I don't think people know, truly the benefits of exercise. All the different things that it could do. If you could put the benefits of exercise in a pill, we wouldn't need any other medication, right? I mean, just there's so many benefits with exercise, especially
Mhm.
when it comes to the hormones. With insulin. I mean, I can, you can go on about it. And so, really encouraging to start moving more if they're not already. Because that plays a role. Talk about weight loss, insulin storage, insulin. I mean, there's just so many things that are beneficial with, with exercise. So lifestyle really plays a huge role, when it comes to, balancing the hormones. And most of that doesn't cost anything, as you know. So if you just, start moving more, so strength training, resistance training, that can go a long way, when it comes to healing. Stress is a big one, cortisol and the impacts on our body. Um, I encourage a lot of stress reducing activities, pamper yourself more. And we know we love our women, and they're so selfless, and I say men, selfish. I tell guys what to do. They can follow it. They don't care about anything else. They'll get it done. Women, they're thinking about everybody else. And so sometimes, oftentimes they put themselves last because they're so worried about taking care of everybody else that they're not spending the time that they need for that self-care. And to me, that's key. I focus on that so much. So you got to take time for yourself. I mean, that just, we're not going to heal if you don't do that. And so for me, that's probably number one, right along with food, of course, is managing stress, taking time out, go and get a massage, your hair, your nails, you got to pamper yourself, right? Take a bubble bath, listen to music. I mean, you got to spend time, doing those things because cortisol is wreaking havoc on their bodies, well, on all of us, but them specifically, because they're really
Mhm.
taking on the brunt of, the household.
Mm. So much wisdom in there. Thank you. As we segue into some other dimensions of this, one thing I skipped, I think we should hear your take on is just why do you think women feel dismissed or unheard? I mean, I've had my biases for years, but I think this is really important to hear from a thought leader like yourself. I mean, maybe there's some solace for women in hearing why this happens, or maybe they're just eager to get somebody who hears them and they don't care why it's broken. I'm not being a woman, I don't know for sure, but
Well, I would tell you that, I mean, it's true. I mean, you probably had the same experience. I hear the different stories of encounters that women have had at the different, offices. And I truly believe that the majority of us as physicians went into being a physician to, help people, right? I don't think anybody went into it for other reasons than that. I mean, I think though, hopefully all of us went into it for that reason. So sometimes when I hear the stories, it kind of saddens me where, um, they're dismissed. They're not able to talk, in that visit, very much. They may request certain tests and the doctor refuses to do that. They suspect, endometriosis, but the doctor says, no, we don't need to, order an ultrasound. We don't need to do an MRI for suspecting endometriosis. Some doctors just dismiss any further treatment. They only want to put them on birth control. And women say, well, I don't want to be on birth control. Maybe they've been on it before, they didn't feel good with it. But, doctors said that's all they all are going to do for them in then going to, different physicians. I don't know, you know, each person, obviously, we're not in that chair. I don't know if they feel helpless as a physician, like I can't help this person, so they're frustrated, and so they kind of just are very short with them, just because they feel inadequate. Maybe because they feel like I can't provide the services for this person or what they need. I'm not sure what the reason is, but we hear too many stories. I've heard too many. I've read too many. The people, just the different things that people say. That's either unprofessional, not really truly taking the time to listen. And I understand, especially in the conventional world where the insurance-based model, you got 10 minutes with a patient. And so for certain conditions like endometriosis, adenomyosis, you can't unpack that in 10 minutes. A lot of the complex conditions out there, we can't truly get to the root of within in a 10, 15-minute visits. That's not possible. That's why we went into the more holistic approach. So we have time to spend with our patients so we can truly unpack it. And so if you're rushed, and maybe they do feel rushed, they don't feel heard because you can't get much accomplished in a 10, 15-minute visit. But oftentimes, too, I really feel like in the conventional model, you really can't address some of these more complex issues, because basically they're looking for a one pill per solution. And we know that that's not happening. Right. It's just not one pill, one surgery that's going to fix a complex solution that most women are dealing with when it comes to their hormones. And so that's why I think there's a lot of frustration, and the treatment out there is because, well, there's not much they can do anyway in that 10-minute visit. And we know that one pill's not going to do it. I don't care if it's an antidepressant or a different birth control or, pain medication, that is not going to get to the underlying root cause of their, condition. So I think that's really what the issue is. And in America and probably in other parts of the world too, that, we're a condition that we got, okay, there's one pill, this one treatment is going to fix your condition. And people just have that mindset of, okay, we're just waiting for that one thing that's going to, fix this. And we know in most conditions, that's not going to happen. It's not a pneumonia that we're treating, right? It's just not that simple with these complex conditions. But people are still looking for, okay, just that one pill that can fix this thing. And that's not going to happen. Yeah. Not at all.
Yeah. If it's pneumonia or broken bone, yes. If it's got a complex chronic backstory, no.
Nope. But we've been conditioned to think that's what it is. Research this, and I don't care all the research you can put into it. It's complex. We know it's a systematic approach. One pill is not going to fix any of these things.
Yeah. Well, I believe you've got a transformative case to share. Or you can, you can talk about a transformative case that could kind of light women up, or men who care about a woman in their life. So do you want to share a transformative case that sort of illuminates how this can work?
Yeah, one of the reasons why I started diving into endometriosis was because of a friend of mine who suffered from it. And, most of us have heard of endometriosis. We've dealt with patients who've had, painful periods before, but, this, because of her, has really got my attention. I think sometimes, like I said before, when people have pain, say, okay, they have painful periods, it is what it is, but for her, I was like, wow, it really opened my eyes. So one day I saw her, she was telling me, because I couldn't remember exactly what's going on, but she, had one of her mood issues, because she had, the depression, the anxiety. And, I asked her what's going on. And then just asking her what's going on, she was telling me, yeah, it's just one of those bad days. And then I probed because I didn't know she had endometriosis. And later on, she told me she had endometriosis. And I think a lot of people who suffer, especially, women, will just kind of keep it to themselves. It's not like they talk about it a lot. And I was like, oh, I didn't know you had endometriosis. So I said, okay. And I said, I could help you with that. And then she looked at me kind of strangely because no one had ever said that to her before. She'd been dealing with it for, over a decade, right? But no one ever said that they could actually help her with that. So that kind of intrigued her and got her attention. And And then I asked her what she was on, and she was doing a depot shot. And I said, well, we can't do the depot shot. So we got to get you off of that so we can start doing the testing. And the look of fear on her face when I told her that she had to stop the shot was striking to me. It was as if I had a knife and I was going to attack her. And seeing that look of fear on her face by me saying that, that's what got my attention. I'm like,
Mhm.
wow. Like usually, if I say that we need to get you out of birth control so we can work on balancing it, it was more of like, yeah, okay, it's a, I have to talk to my husband because we got to figure that out because we don't want to get pregnant or kind of
Mhm.
an inconvenience. But it wasn't never
Mhm.
a fear look of
Mhm.
terror on her face. So
Mhm.
so I'm like, wow. And she was like, yeah, you have no idea because she wasn't having her period because the devil helped to get rid of her period, but she was
Mhm.
still very uncomfortable. Still had the mood swings. She still got some of the pain, but not the pain of having those periods. And so that's what got my attention. So then we put her on the journey. We had to work on the detoxification, get her liver, working better, detoxification system working better. Then the biggest thing, in my opinion, is really getting the gut working better, right? Because we know everything starts inflammation. It starts in the gut. And we know like endometriosis, those painful periods are inflammatory conditions. There's immune dysregulation, all that stuff, starts on the gut. So then once we got that going, and then getting her nutrition, dialed in, more efficiently, because she was already exercising. And then once we got that going, then we can move into the hormones. And then once we got, and I put her on bioidentical hormones. And then once we got that going, she's like her life changed, significantly. She was able to get off her antidepressant that she had been on for, maybe close to 20 years. She's like she has regular cycles. Eventually, her cycles came back, and she had, no pain. It was uneventful. And she was just so grateful. It was almost in tears because like I never thought that she could achieve that, like a normal life. Like she never thought that that could, come back because no one ever told her that could happen. She had been living with that for so long. She had seen, I don't know how many doctors she had seen, but she had already accepted the fact that that was what her life was going to look like, maybe until she was, in menopause or post menopause where her cycle no longer was there. She had already accepted that fact. So I had, broken that thought pattern and challenged
Mhm.
her about it. And she trusted me enough to say, okay, well, I trust you. So let me go through this. Let me get off the depot shot and let's see what can happen.
Mhm.
And, from that experience and working with her and seeing her transformation made me think to really look more into the endometriosis because the look of fear on her face was something, different that like I was close with her, made me pay attention to that more. Because I think we've all heard
Mhm.
about, yeah, if you read about endometriosis, say painful periods, but I don't think we realize how painful it is. Like it's like, I mean, it's a level of, and they all describe it differently. Hot poker, in them, it's worse than pregnancy. I mean, I've heard different stories where debilitating people can't keep a job because they miss so much work because of debilitating pain, canceling plans all the time. And that was her because I asked her, I said, do you
Mhm.
talk about this with your friends? She said, the only time it ever came up was when I had to cancel plans, as
Mhm.
far as that goes. I'm like,
Mhm.
wow. So it's like they just had to suffer through it. And so many women, as you know, it's very common, just suffer through it and they don't think that there's hope out there. And,
Mhm.
my mission for them is like, no, pain is not normal. It's common, but there are solutions if you're willing to put the work in, that you can change your life.
Mhm. Mhm. I'm just so glad you're shining a light on this because if we had to sort of write a list of the things that just really women report are pinning them and intimidating them, I see the same thing.
Yeah,
Of all of these things today, the endometriosis, perhaps because women report that the lining of the uterus, the endometrium, sort of causing discomfort and or migrating out into the abdomen, tethering portions of the bowel, sort of feels like this alien
yeah,
getting away from them. Um, or the fact that sort of female tissue is betraying them, right? There's a sense of betrayal and sort of what? How did I get here type thing. So it's a great sort of proxy. The capacity to help that pretty much says it all that all of these things can shift because that's one of the ones that conventional medicine has some of the least success with in terms of women pretty much ending up on medications that don't work terribly well and or surgery. Let's let's focus on what's something that women can pay attention to right away? You invoke some of it already, but if a woman's hearing this today and they're thinking, wow, Dr. Brown's sharing a lot. So just where's a place for them to land on your approach? Just something they can do if they hear the podcast and think, okay, I'm going to take action today.
Okay. Well, that's a good question because there's actually a lot that they can do. The key is really being consistent. Like that's the key. When the New Year's resolution comes, people may be good for 6 weeks or so, and then they fall off. And I understand with endometriosis, and obviously I can't experience it. We have no idea what that's like, so I can understand the mental toll, the physical toll, the emotional toll that can have on you. So I know it's not as easy to, keep it up, but I would say consistency is key. So one of the things I love is, the spices. And so if you can get in the habit of using ginger, get in the habit of using garlic, cinnamon, on a regular basis. There's good studies behind that, good data behind that, as far as helping to reduce pelvic pain, um, the menstrual pain, just reducing inflammation, the oxidative stress that's occurring with people who have endometriosis, painful periods. So just start using those spices, the turmeric, with the pepper, like just every day, use spices and don't be bashful about it. Just get in the habit of using those spices, whether it's smoothies, your soups, your eggs, whatever that is. Just get in the habit of using those spices. Like I said, food is key. So if you can keep inflammation down, that's going to go a long way, right? So we all know we shouldn't be eating the fried foods, the processed foods, the breads, the gluten. People think gluten's a fad. It's like, no, we don't need that. It's inflammatory. So really they can pay attention to diet, eat more whole food based foods. That's going to go, a long, long, long way, even before anything else. Just, making that shift in your kitchen, in your home, you're going to see a huge difference with that. Just look in your spice cabinet and say, okay, here are those spices, and then just start using them.
Yeah.
Um, that's I mean, to me that's an easy place to start because we got to eat anyway, right?
Yeah.
So then the question is, okay, what are you eating? Because we say food is medicine, and I truly believe it is. But so what does that look like for you, right? On a daily basis, what are you cooking, right? What are you
Hmm.
eating? And you really
Hmm.
should be trying to cook, staying away from the box foods, the packaged foods, all the processed stuff. And I understand the convenience of it, but really to me, it's like, yeah, you're saving on time, but now you're creating more inflammation. So now you're spending more time in bed. So really, is it saving you time? If it's causing you more discomfort, more inflammation. So we can spend time cooking or, getting your partner to cook or your kids, if they're old enough to cook for you when you're not feeling well, using those spices. I think that's the number one place to start, really, I would say, is in your kitchen and looking
Hmm.
at your shopping list. What's on that list of foods that you're consuming? So
Hmm.
that's where I would start because I think that's an easy one to do. And the
Hmm.
second thing I would say is, like I said before, is the stress reducing activities. Everybody's always in a hurry, and a lot of my patients are they're health conscious. They exercise, they watch what they eat. They drink a lot of water. They're on top of that. But the one thing that majority of them are not doing is meditating. They're not praying. They're not doing the gratitude journals. They're not taking the bubble baths. Like they're not doing the things to improve their parasympathetic tone. They're still on fight or flight all day long. And I said, that's going to get you, because they're wondering why they're not feeling well. It's like you're not spending time in rest and digest. So foods and working on the stress, that parasympathetic system is so key, with all of that. So those are two things that you can do at home that to me, it's not that complicated.
Yeah.
It's pretty straightforward that anybody can, at any education level, can understand and do. It's just a matter of being consistent, with it.
Beautiful. Beautiful. I flashed on it a little bit while you were talking. Just when my household leveled up, a couple of what I found to be humorous moments were uh looking at a spice and then looking at the expiration date, 2019. We
Yeah,
we
that's
we found some spice that had come up during our different moves in life. I'm I'm in my late 50s, and we found one that looked like it was from the 1950s. I mean, even the label on it was just crazy. Uh, and then another thing I really like about when we experience what we were describing, at least my household, is that then these friendships we form with the process are so sort of fresh and invigorating because these, like the aroma in particular,
Hmm.
they're turning, you can just feel it turning on the health pathways. I can't think of the right phrase, a healthy body high or natural body intelligence or something, but there's all these extra dimensions that I think make it such a great invitation.
Yeah, it's funny when you say that. I thought about growing up how, a lot of us don't like vegetables. It's like, I don't like the way they taste. And when I started playing around more with the spices, all of a sudden I started really enjoying the the vegetables. And I remember my daughter with the green beans, she would eat them like she's eating French fries. But she actually was enjoying eating them. It wasn't just because I told her she has to eat them. Like when you really use the flavors that the aroma with it, you can really make these our foods taste better. And just to
Hmm.
improve, like you said, this you just feel better.
Hmm.
Before just using salt and pepper, like, okay. And then they start telling you, okay, don't use salt, right? Because like everyone salt's bad for you. So now your food doesn't even taste like that. But there's so many spices, out there that can really ramp up the flavor and the aroma, like you said. And, then and your body just feels good. It's that thank you. Like, right. It's like,
Hmm.
yeah, you're enjoying it and your body feels good,
Hmm.
in taking these spices. But yeah, I'm with you on that. I can relate to some of the spices in the back, the cabinet. Wow. Okay. Yeah, we haven't seen that one for a while. Like, what is okay? Okay. Yeah, we've been guilty, but now it's like, okay, now I'm buying them more because we're using them
Yeah.
more. Yeah,
Yeah. Right on.
yeah.
Well, Dr. Brown, any wisdom you wanted to share that we didn't get to? Any big stuff that'll um, help our folks out there?
It's a good question. Because God, there's so much out there. Bioidentical hormones. We didn't really talk about that. I mean, I know you've had people talk about that, on your shows before. Just the importance of that. Birth control. Is not making you healthier. And there's this studies linking those to different cancers and things. So that's a hot topic. People like to debate about, but um, bioidentical hormones. When done right, putting your body in balance can go a long way.
Hmm.
Specifically, progesterone, is a big one. I see a lot of women that have progesterone resistance. So typically, or deficiencies. So I know if they're suffering, most of the time I'm going to see a progesterone issue. So even if the labs show that they're fine, you may have progesterone resistance, which impacts your body's ability, your cell's ability to utilize the progesterone, that's present. And so those women oftentimes do better when they're using progesterone. Bioidentical progesterone is not the same as birth control. I try to tell people that all the time. It's like progestin, birth control. That's not progesterone. So
Hmm.
don't get confused because you'll see in the conventional world that they will interchange the term progesterone with progestin, and that's not true.
Hmm.
Um, and the other thing is testosterone. Testosterone is not just for men, and that's a misnomer that's been out there for a while, but I think it's slowly changing. And I've seen a lot of good progress with women who suffer from painful menstruation, obviously low libido, utilizing testosterone, because testosterone does work on the immune system, helps to
Hmm.
calm things, down. So I've seen a lot of, fibromyalgia patients get better with, testosterone, people who have this pain. And if you've been on birth control for any amount of time, your testosterone level is going to be depleted anyway. So those people specifically need to be on, testosterone. But again, you got to work with someone who knows what they're doing with
Hmm.
testosterone that could be beneficial. But don't be afraid of it. That's one thing I would say is please don't be afraid of the hormones. You just got to be in the right balance and. Because we all need each other's hormones, right? Men need progesterone,
Yeah.
estrogen, testosterone. Women, same. It's just the ratios are different, and when they're
Hmm.
not where they need to be, and that's when we can pay the consequences of not feeling, optimal. So that'd be the thing that I would say is just don't be afraid of the hormones. Find someone who's, skilled in utilizing the hormones and don't be afraid, to use them. But again, the hormones aren't the whole picture. Like I said, the gut has to be worked out, the detoxification system. Like there's so many different things, stress. Like that's why I said it's a systemic approach. It's not just, a hormone problem. We just
Hmm.
think it is, birth control. But it's like, no, it's a systemic problem that needs to be that needs to be addressed, in a holistic approach.
Fantastic. Yeah, I just love really every podcast because I get to, be with my kindred spirits.
Yes. It's
Folks that
lonely
love it.
sometimes, isn't it? You kind of
It
feel like
can
you're on
be,
your,
yeah,
yeah.
yeah. Maybe that's changing too. But
Yep, it is.
I noticed I signed up to a new streaming platform, and every ad had something to do with functional medicine.
Yep,
Whole
I've seen it.
food, et cetera, et cetera. And I don't think this was targeting me. I think, the world has changed since the last time I saw some ads. So
Yeah.
there's some good news out there.
It is. That is
Yeah.
good.
Where can people find you, Dr. Brown?
So they can find me go to my website, hormonehealthwithdrbrown.com, and doctor is Dr.
Mhm.
Brown. And on there, they will see the, social media links and some of the things that we posted. And that's the easiest place to go is hormonehealthwithdrbrown.com.
Great. Well, thanks a ton for sharing part of your wisdom today.
Well, it's a pleasure. And thank you for all that you're doing out there. I really appreciate it because we need more like you.
Very kind. All right. Take care.
All right. You too. Have a wonderful day.
Thanks for joining us for the Seaworthy podcast. Seaworthy exists to help people overcome their health challenges and be fully vital. If you think we've earned it, please consider giving this podcast a like, subscribing, and giving us a 5-star rating on the platform of your choice. Thanks.